thank you all. I was very much honored to be invited by Hari to speak here, and in particular to speak a lecture that named after Jorma Rantanen, who's really a giant in occupational health. And I've known of the work of the Institute and of Jorma for many years, and it really, no greater honor could be bestowed upon me, and I'm grateful. I'm going to just touch briefly on three issues, and I look forward to our discussion afterwards. The three topics I'm going to talk about a little bit on OSHA, the Occupational Safety and Health Administration, which I run, and how we think about preventing work-related injuries and illnesses, and sort of the role of science in that. I'm going to talk about this, what Hari referred to as mercenary science, and the development of scientific articles and scientific arguments, not for the sake of understanding the world, but to delay and prevent either regulation or litigation. And finally, I'm going to talk about the question of conflict of interest and how we judge science, how we look at scientific evidence in ways that help us understand what the studies are saying. So we'll go through all three of those briefly, and then hopefully we'll discuss much beyond that as well. Shall I just do this myself? Yes. So, oh, I can use this. Yeah. Okay. Okay, that's good. I work under legislation called the Occupational Safety and Health Act. It's very straightforward. Oh, that didn't work though. Let's go this way. Hold on. Okay, well, I can do it. It's fine. The law is very simple. It's, no laws are simple, but it says that employers have to provide a safe workplace. That's the law in the United States. And the job of OSHA is to make sure employers do that. And we have some tools, but our job is to make sure that when a worker goes to work in the morning, he or she can return home at the end of the day safely in the same physical and mental condition that they went to work with. And of course, we have a great challenge, and I think the situation is probably far more challenging in some ways than you have. We have about 4,000 U.S. workers who die every year from work-related injuries. We don't know how many work-related illnesses occur. The studies done by our National Institute of Health says about 50,000 workers die from illnesses which were attributable to chemical exposures that occurred in the past. But currently, we still have significant chemical exposures, and we don't study it very well. Employers report 3 million injuries a year. And what's interesting is we're now doing studies looking at employer reports compared to, say, claims in the workers' compensation system, and we now recognize that we miss between 30 and 60% of them. So the real number is probably about 5 million cases a year, and the cost is very high. I mean, it's, some estimates of $250 billion a year. Whether it's 200 billion or 400 billion, it's far too much and very significant. OSHA has an interesting challenge. We cover all workplaces in the United States except for mines. So I tell people that we do everything from nail guns to nail salons. And all workers deserve a safe workplace, and we have to think about our challenge is to make sure how are construction workers safe, how are nail salon workers safe, and everybody else in between. And of course, the United States is changing very rapidly. It always is changing, but right now it's particularly challenging to us. We have to work in many languages. We have many workers who only speak Spanish. We have workers, the nail salon industry I just chose as an example, a large number of Vietnamese and Korean women work there, many of whom speak no English. The other thing which we do, which we think about a great deal, is our job is to level the playing field. And that's a sort of metaphor that employers who do make a commitment, who make an investment in worker safety, shouldn't have to be at a financial disadvantage competing with those who don't make, who are willing to essentially not obey the law and expose workers to greater hazards. So the way I think about this, so this is all sort of background to this, is that there's a great range of employers, and we see this. There's a huge range of commitment to workplace safety from those who are very much committed and really care greatly about workers to those who have little commitment. And there probably is some sort of bell curve. And actually, we were talking about this earlier. I'm an epidemiologist. I think, of course, in normal distributions. And this is a hypothetical one, but it's likely that the tails are smaller than the middle point. But for every sort of employer, we have to have a different approach. So, for example, for those great employers, the ones who recognize that that workplace safety is a worthwhile investment, there's very little the government can do for them other than saying they're doing a good job. And so we have programs where we give them a flag and a star, and they can fly the flag and say the U.S. government says we're a great employer. And that's really all we can do for them, because they already go far beyond what we require them to do. The other tail in the curve are the employers who care very little. We had an employer recently who had a worker who had a chemical burn on 70% of their body, and the employer did not call an ambulance. He got a car, put him in the back of the car, drove him to a local clinic. After 2 weeks of terrible pain, the worker died. And for an employer like that, I think the only thing you could do for them is probably criminal penalties. And that employer is not going to care anything short of being threatened with jail. Fortunately, most employers, I think, aren't over there, but they're really in sort of in between. And so we offer to those employers who would like to do the right thing, but who don't have enough funding, who don't have the knowledge, we offer a free consultation. And we have a program in every state. We pay 90% of the cost, which any small or medium-sized employer can go to the consultation and essentially get free advice. And it's quite effective. And in fact, we will tell the employer that if you've gone to get free advice, while that process is going on, that could take many months, we will not inspect, as long as you do what the advice tells you to do in those serious situations. And of course, there are others who really don't care about, who don't take the advice, and it's the threat of inspection. Of course, many of these employers, if you talk to them, the small ones especially, they've never had a serious injury. And so I call their injury program, and the philosophical basis of their injury program is luck. They've been fortunate. They haven't had that yet. But they will at some point. And so the threat of enforcement or real enforcement moves them into compliance assistance. So that's our model. My job, I hope actually maybe the curve looks more like this, that everybody's more on the good side than the bad side. We don't know. But my job is essentially to figure out ways to move the curve. To every one of those, we want to move to the next category and keep them moving forward. And we have plenty of evidence that these things work. We think about them as a whole. We think about this as deterrence. How do we essentially deter these problems from occurring? That we use all these different tools, and we have to figure out which is appropriate for which employer in which situation. And my job, because we're a very poor agency, given the size of our country, we have 2,400 inspectors for almost 8 million workplaces, and we cover actually about 130 million workers. We've got to figure out how to use those tools most effectively. The thing that has most impact is our standards, because when you set a standard, you're setting there's a normative change. Employers say to themselves, okay, a standard has been issued. We have to follow that standard, even if inspections aren't occurring, and most employers will do that. And when we issue standards, like we issued a cotton dust standard in 1978, and bisonosis, brown lung disease, virtually disappeared within 10 years. In 1987, we issued a standard for grain handling, because there were explosions every few months in our big grain silos. And the grain bin explosions reduced, actually they've reduced a great deal more since then. Hepatitis B used to be a very significant issue in the healthcare field. Since we issued our standard, hepatitis B infections have gone down 90%. So we have plenty of evidence that these standards are effective. The big debate going on in the United States right now is not around the effectiveness of standards, but it's the economic issue. Does anything that we do, does it kill jobs? And this is the question, because we're in a financial crisis, and there are really attacks on the regulatory agencies, the environmental agencies, OSHA, saying that if we regulate, if we stop, for example, the use of coal-burning power plants to reduce pollution, to prevent climate change, this will kill jobs and hurt the economy. And it's an unfortunate debate, but in fact, I think the empirical evidence is pretty straightforward, because we've seen this movie before. We've seen the debate, and it recurs over and over again. It's fascinating. In 1974, a physician in Kentucky recognized there are 5 cases of a rare liver cancer called angiosarcoma of the liver at one factory. And this is a cancer that occurred, about 20 cases would occur annually in the entire United States, and there were 5 in one plant over a couple of years. So obviously, astronomically high risk, and that plant manufactured vinyl chloride, actually manufactured the vinyl chloride monomer in making polyvinyl chloride, this basic plastic that everybody uses. And OSHA, this is now 40 years ago, OSHA announced that they would move toward a standard. And the industry said, and this is the same debate we hear on whenever we propose a standard, industry spokesman said the proposed standard was medically unnecessary, technologically unfeasible, and would lead to a loss of as many as 2.2 million jobs. 2.2 million jobs being every job in the plastics industry at the time, plus others that were dependent on it. But the scientific evidence was very clear. That was a period when really the science prevailed. OSHA issued a standard reducing exposure to 1 part per million, and what happened? Well, industry was faced with reducing exposure, and the industrial engineers were very creative, just as the Finnish engineers I know are among the world's leaders, figured out within months how to enclose the process and actually save the feedstock. So the standard not only reduced exposure, but actually saved every employer who applied it a great deal of money, because with the rising cost of gasoline, this was during the oil crisis, the cost of the feedstock was very high. So the article from Chemical Week a year and a half later, polyvinyl chloride rolls out of jeopardy into jubilation. The OSHA problem that threatened the viability of the industry 2 years ago, they've installed the equipment needed to meet the worker exposure requirements without inflating production costs to the point where growth may be stunted. In fact, there was no loss of any job. But we've seen this over and over again. So we know that, in fact, these are really situations where saving, in many cases, preventing injuries saves lives and saves money. So we conclude OSHA standards don't kill jobs, they stop jobs from killing workers. We also have done some very important empirical work on inspections. And I know this is something that you all have looked at a little bit as well. And OSHA inspections are actually done on a randomized basis. There are various Supreme Court rulings that said, I can't, as head of OSHA, just say I want to go inspect that company because I don't like them. We have to choose a category of employers and randomly choose the one to visit, so we can treat our inspections as clinical trials. And there are 3 studies that have come out in the last 2 years that showed that, in fact, compared to other places we do not visit, OSHA inspections reduce injuries by as much as 10% over the course of the next 5 years, and actually save employers a great deal of money as well. So we know that. We know these work. But we face great challenges. Our occupational exposure limits, we call them permissible exposure limits, are extremely out of date. There are about 80,000 chemicals in the workplace. We have occupational exposure limits for 500. And you don't have to go through all this, but the main point is that of the 500 or so we have, almost all of them, 470 of them, date back more than 40 years, some of them 50 or 60 years. They're all out of date, and we have no mechanism to improve them. So we're faced with an interesting challenge of how do you protect workers when your standards are old, and we have no ability to really update them. One of the reasons for that, and that gets this question of sort of the debate over the science. There are a lot of reasons for it, but it was as it becomes clear that OSHA standards are something that industry doesn't want, there's a increasing scientific debate over every one of these standards. And when we issued our vinyl chloride standard, that was based on these case reports from this one physician in Kentucky, and there were 2 animal studies, right? The Dr. Maltoni studies in Italy. Now we have to do many, many studies. We have to go through all of the literature. And as you could see, in 1974, we could issue a standard. The entire standard with the preamble and regulatory text was 10 pages. By 1997, that had gone up, by a factor of 10, and then doubled again. And we just issued a proposal for a silica standard, which by the time we go final will probably be twice the size as well. That's economic analyses, but also going through the scientific literature, because we know there'll be a fight over all of the science. And that's really what I'm getting to here, the sort of the fight over the science. And what is, how do we judge science that we use for environmental and occupational regulation? Obviously, we have to base our science, our regulation in science, but there's always going to be uncertainty. For chemical exposures, for environmental exposures, we don't do clinical trials. We don't randomly assign people to different exposures and follow them for years. We have to take the world as it is. And so there's always going to be substantial uncertainty. And we can't automatically extrapolate from an animal study to a human study. But you need some level of certainty. You can't just say, well, I'm just concerned about a chemical, I'm going to regulate, I'm going to issue some standard for it. So we need some certainty. Ideally, that should be based on the possible consequence of not regulating. Obviously, the discussion about climate change now is the discussion we have about that. We're not absolutely sure that carbon emissions will cause significant climate change, but if we don't do anything and and this really does occur, obviously the consequences are great. So the challenge for regulators is to differentiate between actual scientific uncertainty and what I call manufactured uncertainty, which is what we see now. And the history of manufactured uncertainty comes from tobacco, and they really have figured it out. We think about tobacco as being the cause of this gigantic epidemic of lung cancer, but that's in some ways a relatively recent event. Widespread smoking in the United States didn't occur till World War I, when soldiers were given free cigarettes. And so the lung cancer epidemic really didn't take place until the 1940s, given 20, 30 years for it to occur. But by the 1950s, there was plenty of evidence that case control studies showing that people with lung cancer were much more likely to be smokers. It was very clear by the 50s to many people that there was a link between smoking and lung cancer. And so the tobacco industry realized if they didn't address this problem, this scientific problem, they were in big trouble. And so they essentially looked to the newly formed public relations industry to take on the science and to control the science. And they started doing things like they had their own journal that anytime they can find an article which questioned the basic sort of hypothesis that lung cancer was caused by smoking, they would publish it. I should have brought the one that said, lung cancer less likely in bald men. And after lawsuits, we have a number of documents that really showed exactly what they were doing. And I named my book after this. There's one document where one of the executives at one of the tobacco companies wrote that what we're producing is not tobacco, doubt is our product. Since it's the best means of competing with the, quote, body of fact that exists in the minds of the general public, it's the means of establishing controversy. And that's exactly what they did for many years. What's interesting, though, and because we're not focused on tobacco, everybody knows that story, is the same scientists and the same public relations firms moved into other areas. And this was a document, Hill & Knowlton was the public relations firm that worked for many years for tobacco. This is from a document that they sent to the beryllium industry, which I saw when I was at the energy department, because beryllium is an important product in nuclear weapons, so we gathered a lot of information on that. Where Hill & Knowlton had said to the beryllium industry, look, you've got a problem, we're going to help you deal with this, and look at these other things that we worked on. And they sent a little description of each one, and it's all in my book, and we actually have it all online. But to give you one example, fluorocarbons. So there are allegations, now this is a legal term, this is not a scientific term, right? Allegations that fluorocarbons released from aerosol spray cans were a threat to the Earth's ozone layer. This had become a cause célèbre in the media and government. despite the fact there was no real scientific proof. There was, it was only theory, and people theorized. A couple of scientists showed very elegantly how these chlorofluorocarbons are interacting with the ozone and causing a hole in the ozone layer. There was no real scientific proof. It would be years before facts could be assembled. The media fastened on the threat of increased skin cancer and the doomsday aspect of the study. And here's the key thing. Public concern and fear about the future caused fluorocarbon users to look for alternatives. Helen Knowlton was asked by DuPont to help calm fears, get better reporting of the issues, and gain up to 2 or 3 years before the government took action. So there was no question. I mean, the science was there. DuPont saw that it was inevitable. But if they could delay it for 2 or 3 years, they would be able to keep their market share by selling an alternative product. What isn't here is, of course, the ozone hole got bigger for 2 or 3 years as a result of this. And, of course, the science wasn't questionable. In fact, the folks who did that got the Nobel Prize. I mean, at the time, it was very clear that their work was elegant and irrefutable. But that didn't stop Helen Knowlton from saying, there are questions here, let's wait and figure it out more. So the same folks who were doing that for tobacco, this is another group, the Weinberg Group, which actually has an office now in Brussels, worked a lot for tobacco, and they started marketing their services, and this is from a PowerPoint they actually had on their website briefly. Asbestos, tobacco, pharmaceuticals were all next. Scare of science, the loss of presumptive innocence. So the idea is that a chemical would be innocent until proven guilty. And so you need the Weinberg Group to help you essentially defend the chemical. And they call it that, product defense. They called it that. And they then hired the same scientists who worked for tobacco to then work for all these other industries. This was really, I wrote about this in Scientific American, but before I wrote about it, this was on their website. They took it down. But this was an example where the Weinberg Group was hired by manufacturers of a drug that the U.S. Food and Drug Administration was going to take off the market. Now, the U.S. Food and Drug Administration does not take drugs off the market easily. There are only 2 reasons to take a drug off the market. One is if it doesn't work, if it has no effectiveness at all, it's not allowed to be sold, or if the harms greatly outweigh the benefits. If the potential danger of that drug, it has to be very, very serious, because all drugs have some unfortunate effects, but they're useful in many ways. So if the harms of it greatly outweigh the benefits. So this just give you briefly, Weinberg Group was hired by some 2 manufacturers of a drug. They did all these different things. It led to an extensive process with a written appeal from the first decision, leading to 10 additional years of sale prior to the ultimate cancellation. So eventually, it was taken off the market. But for 10 years, this drug, which probably shouldn't have been sold, was sold. This is a business, and that's what they do, and they did it well. I call this the Enronization of science. Now, you may not know Enron. It was a U.S. company. It was a house of cards. It was just this fictitious accounting scheme. They made it look like they were making a lot of money. They really weren't. And when it finally collapsed, a huge number of people lost their pensions and their savings based on that. But the basic idea is scientists are now hired to defend products and polluters in the regulatory and legal arenas. And they produce studies not actually to provide valid science, but to influence regulation and litigation. And the science, in fact, in terms of understanding the way the world works, is of little, if any, value. And I think it actually has an effect on how people view science. When individuals read about this in the newspaper and say one scientist says this, they say the opposite, it leads to a cynicism that's really unfortunate. And sort of anti-science, it encourages the anti-science tendencies in the population. And of course, it's used greatly in global warming. This is a memo written by a political consultant in the United States to the Republican Party about winning the global warming debate. And this is, if you're going to win this debate, the way to do it, and this fellow wrote this, the scientific debate remains open. Voters believe there is no consensus about global warming within the scientific community. Should the public come to believe that the scientific issues are settled, their view about global warming will change accordingly. Therefore, you need to continue to make lack of scientific certainty a primary issue in debate. And that's exactly what's been going on for a number of years. It's unfortunate, but this becomes then, this is a debate that's fed by sort of material interests to ensure that people who, companies that pollute are able to continue to pollute companies that are taken to court are able to win in court. So I want to give you an example of how that's moved then. This, sort of the science has moved from tobacco into other sort of toxic chemicals, and my book has many examples. The one I'll just go through very briefly, benzene, a very well-known carcinogen. IARC identified it as a known human carcinogen in 1987. There really is no debate over the carcinogenicity of benzene. In 1987, Bob Rinsky, who's an epidemiologist at the U.S. National Institute of Occupational Safety and Health, did a fabulous paper looking at workers who are exposed to benzene, almost nothing else. That's why they looked at this factory. They looked at 1,100 white males exposed, and they had all the exposure levels were provided by the employer, and they found a very clear dose-response relationship. If you worked for 40 years at 1 part per million, very low exposure, you had a 70% increased risk of leukemia, and they gave the correct public health interpretation. An exponential decrease in the risk of death from leukemia could be achieved by lowering occupational exposure. Of course, the problem with this is the petrochemical industry, particularly the oil industry, produces a lot of benzene. There's a lot of benzene exposure in the refining of petroleum and other products. So it's not just benzene itself, but as a byproduct or as not really a contaminant, but the exposures occur. And that was a problem for the American Petroleum Institute, which represents all the oil companies. So what did the oil industry do in response to this study? Well, they got Bob Rinsky's raw data, and any study paid for by the United States government is available to anyone to get their raw data, and they actually commissioned 2 different reanalyses. The first time they said, well, all the exposure levels provided by the employer were wrong, and so they put in a new model with much higher levels, and if you put in the higher exposure levels, then the risk related to the exposure level is less, of course. And that study, they said, look, it has no impact. Essentially, benzene only causes leukemia at very high levels. The problem is the estimates they came up with would have killed all these workers from acute benzene poisoning quite a bit earlier. So that was criticized. So then they did it again. They hired someone else to do it. Came up with lower levels. They had different, and needless to say, each time they did it, they found lower risk estimates. The first paper was 53 pages. Now, Rinsky's paper in the New England Journal of Medicine was about 8 pages. The first paper they published was 53 pages. The second paper was 104 pages with all sorts of tables, just the reanalysis. So why do you publish a paper with 104 pages? Because it looks impressive. No one ever reads all. They put every table in it they could, because you could go to court with a paper of 104 pages that looks more impressive than a paper with 8 pages, even though this is from really a vanity journal, and the other is one of the leading medical journals in the world. That didn't stop them. So what happened then is the National Cancer Institute went to China, and they were interested in quantifying the risk of benzene exposure and also teaching the Chinese epidemiological technique in collaboration with the Chinese National Cancer Institute to essentially work with them so that our top epidemiologists went to work with their top epidemiologists. And they did a study of benzene in China. I don't need to tell you, China's a great place to do epidemiology. There's very complete follow-up. You need people to participate. They all participate. And they found 74,000 benzene-exposed workers. They actually had exposure. They had the rates compared to non-benzene-exposed workers. They didn't have to do national comparisons or anything like that. They had very clear exposure measures, and they found the same results as Rinsky, the same numbers, the same dose-response curve. And of course, they found this, worked with the same conclusion. And they found that for not just leukemia, but for all hematologic neoplasms, they found increased risk of Hodgkin's lymphoma and other diseases as well. Very straightforward, very good study. It was 6 pages long. As published in the Journal of the National Cancer Institute. So what did the American Petroleum Institute do? Now they could get the raw data here, but it wasn't going to help them any. They tried that twice already. So they decided to go to China themselves. And we found these documents through a source at the American Petroleum Institute. They said that they've decided to do their own study in China. This is the description, that they're doing a study to respond to allegations. Again, this is a legal term. It's not a scientific term. They're not replicating the study because it's, this is replication in terms of science, but they're responding to allegations from a nationwide study of, done by U.S. and Chinese researchers. Describe the significant issues. The expected health effects of ambient air concentration in benzene currently drive calls for reformulation that would have a massive financial impact on refiners. So in other words, the findings hold that benzene at low levels causes these diseases, and it's going to have a big impact on the refiners, and they're going to be in litigation from these other forms of leukemia and essentially lymphomas. That's going to cost millions of dollars to the industry, so we need an alternative study. The project value, how will the research results enhance industry's ability to achieve their objectives? The planned research is expected to, and this is before the research is done, provide strong scientific support for the lack of risk of leukemia or other hematological diseases at current ambient benzene concentrations, and establish that adherence to the current occupational exposure limit do not create risk, a significant risk to workers exposed to benzene, and refute the allegations that non-Hodgkin's lymphoma can be. So they know what they're going to find already before they've started the study, and they're going to divide the cost across the industry. Now there's example after example like this, where industry has said the way to respond to science is sort of develop sort of equal and opposite science. Because in that case, if regulators look at these two opposing pieces of science, they're going to say, well, we can't do anything, let's wait for more. And this is the problem we see, and we see it in virtually every sector these days. So I have a lot of discussion like that, but I'll limit it to that. The third thing I want to touch upon, though, is this question of conflict of interest and the interpretation of science. Because one thing government agencies use we use scientists to help us understand the scientific literature, because we never make decisions based on one study. We have many studies. There's always uncertainty. There are real contradictions for various good and bad reasons. And so how do we figure out what is the truth? And we use scientists. We put panels together. IARC has monograph panels. I have several advisory committees that report to me. They look at science and they say, okay, here's what this science means. And so we have an interesting example here that helps work through how scientists and how conflicts of interest affect scientists. And this is a drug that was called in the United States Vioxx. Was it marketed here as Vioxx? Very well-known painkiller. It has a very rapid rise and fall, and it's a fabulous example to understand thinking around science. So Vioxx was approved in 1999 by the U.S. Food and Drug Administration. It was a great drug in that it's a painkiller, it reduces pain, but doesn't cause sort of the gastric problems that aspirin and a few other drugs do. The early clinical trials were not perfect in that they didn't use a placebo. They couldn't use a placebo because we already have painkillers, right? So you compare Vioxx to other painkillers, and the objective is to find a painkiller that's as good as the current painkillers, but don't cause the side effects of aspirin or other things. So those early studies, which compared Vioxx, in this case, to a drug that's marketed in the United States as Aleve or Naproxen, I'm sure it's sold here too, they lent themselves to conflicting interpretation. Let's put it that way. So this is less than 2 years after Vioxx was approved, and the marketing was huge. The Journal of the American Medical Association published a review by 3 scientists, independent, very well-known cardiology epidemiologists, who wrote that patients taking Vioxx, according to their interpretation of they went back to the raw numbers and they said, look, it looks to us like patients taking Vioxx had 2.5 times the risk of cardiovascular events compared to those taking Naproxen. Now, there are 2 ways you can interpret that. Remember, these are randomized clinical trials. The first is that Vioxx increased the risk of by 2.5. What's the other way to interpret it? Well, then Naproxen reduced the risk by in this case, it would be about 70%. Now, if we had a drug that reduced the risk of cardiovascular event by 70%, we put it in the water supply. And it would be a miraculous drug, but that's essentially the 2 ways you can interpret it. And so the very well-known academic scientists, we're not talking about scientists who work for Merck, but these are well-known cardiologists who are consultants to Merck, looked at this and they said, no, the differences observed between Vioxx and Naproxen are likely the result of the antiplatelet effects of the long duration. In other words, Naproxen is preventing heart attacks. And they said, this is, and so of course that debate went on, And these are, very respected scientists said this. And so Vioxx continued on until the double-blind placebo trial occurred. And the reason it occurred was not to check to see if Vioxx was a good painkiller, but there's indications, which turned out to be accurate, that Vioxx reduces the risk of colon polyps. And yet we have no drug that reduces the risk of the incidence of polyps or small growths in the colon. And so you could do a randomized clinical trial, and Merck did that correctly, and what did they find? That the risk of heart attacks was so great that they stopped the trial early, and they actually were told by the Food and Drug Administration they had to pull Vioxx from the market because it was causing heart attacks. So Vioxx, it turned out, by the clinical trial, really did cause heart attacks. And only by having the additional evidence do we see who was right. By then, 20 million Americans had taken the drug. This is, 5-6 years into it. And the estimates from the United States were that Vioxx had caused between 88,000 and 140,000 heart attacks. And this is a gigantic public health epidemic, which is basically invisible because we have many hundreds of thousands of heart attacks a year. And it's reasonable to think that Merck actually had no idea. I mean, you could say that Merck was, this evil company that was, really wanted to sell this drug even though they knew it was dangerous. But if they really knew it was dangerous, they wouldn't have started the double-blind placebo trial for colon polyps, right? They really believed, everybody at Merck believed this was a great drug and couldn't possibly be causing any heart attacks. And these academic physicians the same way. They were so invested in thinking about the drug as a great drug, when they read the evidence that to any independent scientist was, said the opposite. They said, Vioxx, prevents most heart attacks. And, now you look back on this and say, how could they possibly have read the literature so wrong? And so this is the question. How do you think about, how do you convince yourself that something which is obvious in one direction is really the opposite? And there's an American writer who wrote this in 1935, which I think really does sort of capture it. And I think this is true. There's plenty of evidence that the executives at the asbestos firms, up until the end, sort of really believed that asbestos couldn't possibly be causing these lung cancers. And yet, all apparent evidence was. So this is a significant problem. And what it says to me is that financial conflict of interest is not something that's easily addressed. It's not manageable because it does change the way you think. There's a Cindy Lapras on, money changes everything. It's really true. I mean, things, the way you're paid does influence the way you think. And even though you could say it out loud, you could say, this is who pays me, but it would never influence me. I think the reality is it does. And you can't stop it, and it's invisible. So there are some things we can do about this, I believe. The first is, I think it's very important when thinking about scientific evidence, you have to conduct rigorous systematic evidence reviews. Now, that's why I'm so pleased that the Institute is involved in the Global Cochrane Collaborative. And I think those approaches where you sort of have scientists openly, with transparency, really review the evidence and make it very clear how the evidence is being reviewed, then a lot of these studies are done, the first set, the mercenary studies fall by the wayside because they're really garbage. And once you spend a little time with them, you realize they're garbage. Data reanalyses are very easy to do, and I have plenty of examples of them. It's a parlor trick for epidemiologists. If you give me some data and I know exactly what it says, and I can figure out for you how to reanalyze the data in a way that will give you a different conclusion. And there are lots of ways you could change the exposure categories, you can change the reference groups, there are lots of ways to do it. If you do it post hoc, that's easy. We have rules that say you have to lay out your methodology in advance, what your hypotheses are, and follow those methods. If you change them halfway, when you see what the results are going, that's cheating. And that's, systematic reviews get rid of things like that. Full disclosure, publication conflicts. It's remarkable to me that as a regulator for the U.S. government, I don't get the same information that the editor of the Journal of the American Medical Association gets when someone sends in a study to say this to influence regulatory process. Right now, we have a proposal in public comment in the United States to reduce the exposure level to silica, which is a well-known cause of silicosis and lung cancer. For the first time ever, our agency has asked people who submit comments to provide the same disclosure that they would have to provide if they sent a publication into Science Magazine or the New England Journal of Medicine. And I've gotten a great deal of negative feedback about that from groups in the United States who believe that would be prejudicial to know who paid for the study or if there's a financial conflict of the person who sent it in. But we'll see where that goes. And obviously online access to all disclosed information. Some journals get the information, but then they decide, it's up to the editor to decide how much they're going to publish. And I think that's probably a mistake, that the editors shouldn't do that, the disclosure information should be public so others can see it. But I think you have to eliminate conflict of interest. I think they can't be managed. And this, I think, is one of the great advances that IARC made in the last, I guess, 7 years or so, when they moved to structure their monograph panels with members with no financial conflict of interest. They invite distinguished scientists who may have a financial conflict to come to the meetings to make presentations, but they can't vote and they can't write. They don't write the monographs. And I think that's led to high quality monographs and ones that are irrefutable, have much more credibility. And I think we have to level the playing field for science as well. Right now, the laws in the United States, for example, say that if the US government has paid for a study, all the raw data are available to anybody who wants them, and they can be reanalyzed, they can be played with lots of different ways, and they do. That's not true of private science. If a study is paid for by a manufacturer, the raw data are not available, and they're rarely made available. And so I think we need a sort of a level playing field in that case, so everybody can see the data, to be able to evaluate it well. So that's my talk. I think there are some great advances. We have made some advances. I think there are more to make. But I think there's some great things we can do together. And I really look forward to the discussion here coming up. So thank you all very much.